And therefore, it's important to understand that these are the tests we can do, which is an AMH level and a natural. So in our clinic, they get a good response. What are some of the things we do? How do we treat poor ovarian responders in IVF cycles? One of the hardest things to do in an IVF treatment cycle is to treat poor ovarian responders. What does this mean? This means someone who's done an IVF cycle and grown 4 or less follicles. We want patients who've grown lots of follicles because they have lots of eggs and lots of embryos and therefore a much better chance of getting pregnant. Poor responders have few follicles and therefore few eggs and therefore few embryos and therefore a lesser chance of getting pregnant. And it's no fun having to deal with a failed IVF cycle. And therefore, it's important to understand that these are the tests we can do, which is an AMH level and a natural follicle count. So you're prepared in advance that you may be a poor responder, but often a past history of being a poor ovarian responder in an earlier IVF cycle is very valuable information. And armed with that, we can then tailor a better treatment superovulation protocol for patients who had a poor ovarian response in other clinics. So in our clinic, they get a good response. What are some of the things we do? One thing is we will often put them in supplements which will help to improve ovarian reserve. This includes things like dehydroepiandrosterone, low cost and low risk. Second is we will use only gonal-F, which is gonadotrophins for superovulation, because some of the urinary gonadotrophins today these days are such poor quality because of batch-to-batch variation that even if the patient has good ovaries and good eggs, she will not respond well because the quality of the injection was bad. We will also offer patients a choice. We will use aggressive superovulation to try to help to recruit lots of follicles. And if that doesn't work, we will paradoxically offer them the option of minimum stimulation. But we will say, well, in any case, even in spite of a large dose of injections, you're only growing 2 or 3 follicles. Why don't we just get those 1 or 2 of follicles in a minimum stimulation and hopefully those will have good eggs? The good news is options are available. Please explore them.